Acute pancreatitis is a common cause of upper abdominal pain. Acute pancreatitis is one which happens suddenly. Common triggers are gallstones, alcohol, trauma, upper abdominal injury, hypertriglyceridemia, hypercalcemia, or sometimes post-intervention, that is post-ERCP. So these are the few causes of acute pancreatitis. Patients experience severe upper abdominal pain in the upper abdomen like a band. Often the pain is radiating to the back. The pain is often very sudden onset, and they also have nausea, vomiting. This is one of the worst kinds of pain the patient experiences. Acute pancreatitis is nothing but damage to the pancreas which happens suddenly due to the activation of the enzymes which are produced with the pancreas. Normally these enzymes, the digestive enzymes, are in inactive state. So due to certain triggers, as I mentioned, these enzymes get activated within the pancreatic cells and start damaging the pancreas. In more than 85% of the patients, the acute pancreatitis can be self-limiting. It doesn't cause any sequelae. Majority of them will improve, and they may not have any further attack if the cause is treated. But in 15 to 20% of these patients, the pancreatitis can become very severe and lead to multi-organ failure. They may develop acute necrotizing pancreatitis, where the pancreatic tissue and the fat surrounding the pancreas will necrose, and this will get infected. This is one of the most life-threatening problems. Many of them land up in a ICU, and they will be on a ventilator. They need renal support, it's a dialysis, etc. They may need multiple interventions to remove the infected necrotic tissue, the infected fluid and all, and also need high-end antibiotics. So necrotizing pancreatitis is a very complicated condition, very severe life-threatening condition. The illness is very protracted, and patients may need multiple interventions and ICU care. So the patients who are having acute pancreatitis can get recurrent episodes if the cause is not treated. Most common causes, as I said before, are alcohol and gallstones. The patient is taking alcohol, he has to stop taking alcohol. Gallstones, you need to do a cholecystectomy. So we advise laparoscopic cholecystectomy in the same sitting. So the patient admitted for pancreatitis, the same before discharge, you do the gallstone treatment, it is cholecystectomy. If the cholecystectomy is not done in the same setting, it's very likely that within no time they will develop another attack of pancreatitis, which need not be as simple as that. It may get complicated. So to avoid recurrent pancreatitis, you have to do a cholecystectomy if gallstones are the cause of pancreatitis. Patients who are having hypertriglyceridemia have to consult a physician. These triglycerides have to be brought down. So any triglyceride more than 400 or 500 can cause pancreatitis. The higher the triglycerides, the higher the chance of getting a acute pancreatitis. You have to take statins and fibrates, fenofibrate like medications to bring down the triglycerides. So you have to monitor the triglyceride levels and continue the treatment till the triglyceride levels become normal. In some cases, patients with hypercalcemia, you have to evaluate the cause. They may be having a parathyroid adenoma, so you may have to undergo surgery and remove that. Hyperparathyroidism causing hypercalcemia or any other cause has to be identified and treated. In some cases, there are some anomalies like cortical cyst or abnormal pancreaticobiliary junction. All with an MRI, we'll be able to diagnose this, and then we can treat them appropriately. My name is Dr. Dattaram. I'm a senior consultant surgical gastroenterologist and laparoscopic surgeon. I'm a HPB surgeon. I treat patients with conditions related to the liver, pancreas, and biliary tree. Acute pancreatitis is a very common condition which I treat. Necrotizing pancreatitis is one thing which is my area of interest.